Hello guys, still on the overview of the lower limb. In this class, we'll take the whole overview of the muscles of the lower limb according to the regions by region. Do you understand? So this class, we'll talk about the muscles of the lower limb. It is the overview. Do you understand? When we get to their regions, we are still going to teach them. Remember that we said that each region will be a chapter. That means gluteal region will be a chapter on its own. Your thigh will be a chapter on its own. Leg will be a chapter on its own. Foot will be a chapter on its own. And this class is going to be so choky because we're going to learn a lot of names. And those names, I want you to learn them first because this is our first time of meeting them. You're just going to learn them. You're going to appreciate them. As we go further, by the time you see them continuously, you get used to them. So at this first time of learning it, it's going to look somehow strange, but they are very simple. I'm going to give you a lot of mnemonics to remember them. I'll back every statement with a past question. This will be our LCCs, the muscles of the lower limb. I'll start by telling you that the muscles of the lower limb are strong and they help for movement. So they are strong and they help forward for movement. Now, what are the muscles of the lower limb? We're going to study them region by region. First, talk about the muscles of the gluteal region. We'll go further to talk about the muscles of the thigh region. We'll go further to talk about the muscles of the leg region. I'll talk about the muscles of the foot region. So we'll take them one after the other. I will say the muscles of the lower limb are strong and they help forward for movement. In fact, we said that they bear the weight of the body. So let's now start with the first guy, the muscles of the gluteal region. Hold on a bit. The complete series of classes in anatomy, all of them, physiology, all the physiology, biochemistry, all, they are available in the LearnLift app. So just head down to Play Store or App Store and type LearnLift, right? And then download the app and you have access to all your classes and the continuation of this lesson you are watching right now. For the now, peace out. Now, take note that the muscles of the gluteal region first can be divided into two. We have those that are superficial and those that are deep. So most of the gluteal region are divided into two. Number one, we are able to call the word the superficial muscles, and number two, we are able to call the word the deep muscles. Now, what are now the muscles of the gluteal muscles that are superficial? There are four. First of all, I call them the MMM. So let's say the MMM. MMM. We have what we call the gluteal maximus, the gluteal minimus, the gluteal medius. And there's a muscle we want to talk about which is called your tensor facial lateral. Tensor facial lateral. Do you understand? So let's now list what are the superficial muscles. Number one, we'll talk about the gluteal maximus. We'll talk about the gluteal medius. Today we'll talk about the gluteal minimus. I'll talk about the tensor facial lateral. Now take note. Now let's explain. From the word gluteal, talk about these are muscles of the gluteal region. Maximus, the word maximus means big. Medius means it is medium. And minimus means it is what? It is small. So that's why we have the gluteal maximus, gluteal medius, gluteal minimus, and the tensor facial lateral. Now the word tensor in Greek means any muscles, anything that stretch. Tensor, anything that stretch. The word fascia talk about a muscle covering, while the word lateral means side. So it is a muscle that stretch that is found at the side. You're going to see it is found at the side of the thigh. That's the lateral aspect of the thigh. It helps to stretch the hip joint as well as the knee joint. Do you understand? Everybody, what are the superficial muscles of the gluteal region? We have the MMM, the gluteal maximus, the gluteal medius, the gluteal minimus, and we have the tensor facial lateral. Now, what are now the deep muscles of the gluteal region? The deep muscles of the gluteal region, take note that they are all, when we also get to your sciatic nerve, the deep muscles of the gluteal regions are all the landmark of the sciatic nerve. They form the relations of the sciatic nerve. First, we are able to call the piriformis muscle. After the piriformis muscle, we're going to talk about the obturator internus muscle. After the obturator internus muscle, we'll talk about the superior gemini, inferior gemini, and we'll talk about the quadratus femoris. Are you seeing it? So the first one is what to call the piriformis muscle. After that, the second one is what to call the obturator internus. Obturator internus is what divides the gemini into two. So with the next one, we're going to have the superior gemini and the inferior gemini. And the fourth one is what to call the quadratus femoris. Everybody, what are the deep muscles of the gluteal region? The deep piriformis muscle, obturator internus, superior and inferior gemini, and the quadratus femoris. Take note that it is this quadriceps femoris that is going to, this quadriceps femoris is what divide this gemini muscle into two. Now made us to have a superior and inferior. I'm going to show you. And we have the word the quadratus femoris. We said that the muscles of the gluteal region are divided into two: those that are superficial and those that are deep. The superficial are called the MMM, the gluteal maximus, gluteal medius, gluteal minimus, and we have the tensor fascial word later. While the deep muscles are called the word the piriformis muscle, the obturator internus muscle, superior and inferior gemini muscle, and the quadratus femoris. And we said that the obturatus interna is what divide the gemini muscle into two, that is superior and inferior. Now, let's appreciate the diagram. Now, first, let's start with the tensor fascial later. Look at it. This is what we call the tensor. We said the word tensor means stretch. The word fascia talk about recovery, while the word later means side. You can see that this muscle is at the side, so it aims to the word to the knee joint, as well as what it finds surface, as well as the hip joint. So it play a role too in the hip joint. So the first muscle is the word the tensor fascial later. Is this superficial or is deep? We said it is the word superficial muscle of the word of the gluteal region. Do you understand? Now let's now talk about the MMMs. Now look at it. The first what we call the word the gluteal maximus. Look at it. It is this big muscle you see there, the gluteal maximus. The second is what we call the word the gluteal medius. This is the point for intramuscular injection, the gluteal medius. Now, if you remove the maximus and you remove the medius, you're going to see the minimus, which is number 3. So if you remove the medius, you're going to see the minimus. If you remove the gluteal maximus, you are going to see the deep muscles. This first one is what we call the piriformis muscle. This is what we call the obturator internus. We said the obturator internus is what divide the gemini into two. You can see one on and one on top. This one is what we call the superior gemini. This one is what we call the inferior gemini. And this is what we call the quadratus femoris. So those are the deep muscles. So you can see that the deep muscles are found when you remove the gluteal maximus. So if you remove the gluteal maximus, you are going to see the deep muscles. If you remove the gluteal medius, you are going to see the gluteal minimus. Do you understand that? So everybody, what are now the superficial muscles? Say we have the gluteal maximus, we have the gluteal medius, we have the gluteal minimus, and we also talk about the tensor fascial later. Are you seeing that? Now, take note that the superficial muscles, they do 3 things. I'm going to talk about that. The superficial muscles are known as the extensors of the hip joint. 2, they are said to be the AB dot. They are the abductors of the hip joints. AB dot abductors of hip. And number 3, they are the medial rotators of the thigh. Number 1, we said they are the extensors. Now I'm talking about the superficial. The superficial gluteal muscles, they are 4. Number 1, we said they are the extensors of the hip joint. Number 2, we said they are the abductors of the hip joint. And number 3, we said they are the medial rotators of the lower limb, that's on the thigh. While the deep muscles have majorly one function, those ones they are the lateral rotators of the thigh or lower limb. Are you seeing that? So now we have talked about the superficial muscles. I want you to also note something. Now look at this muscle. This is the gluteal maximus. This is the tensor fascial later. This is the gluteal maximus. Take note that 75% of the fibers of the gluteal maximus are inserted into the iliotibial trap. So we can say that the tensor fascial later, the gluteal maximus, both of them come together to form a deep band and run down. That band is what we call the iliotibial tract. So 75% of the gluteal maximus fibers enter to form what we call the iliotibial tract. So it is not just that, not just the gluteal maximus, even the tensor fascial later. The tensor fascial later and the gluteal maximus, 75%, because not all, you can see these ones are not entering. But these ones from here are entering. So 75% of the fibers of the gluteal maximus and that of the tensor fascial later continue as what we call the iliotibial tract. We're going to talk about the iliotibial tract when we get to the gluteal region. Do you understand, everybody? 75% of the gluteal maximus fibers enter into the iliotibial tract, as well as talk about the tensor fascial later. So the tensor fascial later and the gluteal maximus, 75% of the gluteal maximus continue down to form the iliotibial tract, and that's a constant past question. Another past question to also know is that we said that the gluteal medius is the point for intramuscular injection. We're going to still talk about that, but take note that it has original insertion. Now, all of them has original insertion. In this class, we're just trying to know their names, but we're also going to see some past questions to take note that the gluteal medius, the origin of the gluteal medius is the posterior ilium. Origin is the posterior ilium, which is between the superior and the middle gluteal lines. Just know that the origin is what posterior ilium. We're going to talk about that. But there is the insertion. The insertion is at the word gluteal trochanter. Where in the gluteal trochanter, the anterior and the lateral aspect of the gluteal trochanter. The anterior and the lateral. So the anterior and the lateral surface of the gluteal trochanter is where we have the word the insertion. Everybody, what's the origin? Posterior ilium. But what's the insertion? The anterior and the lateral part of the word of the gluteal trochanter. What muscle do you say is that's the gluteal medius, because it's the point of intramuscular injection. So that point is very, very important. So if you say you understand that now, let's take one or two past questions. The past question says that write true or false for write T for correct and false for incorrect. The question says that the tendon of the gluteus maximus inserts into the iliotibial tract. True or false? Now we said that the 75% of the fibers of the gluteus maximus enters into the iliotibial tract. We also went further to talk about also the tensor fascial lata. So is this correct? Yes, it's very correct. So the answer becomes what? True. Do you understand that? Now let's see. Next past question. Everybody reason it and look at it and tell me the answer. The question says that write T for true and F for incorrect. What's the question? The question says that the gluteus maximus muscle has a distal attachment to the iliotibial tract. The gluteus maximus muscle has a distal attachment to the iliotibial tract. Is that correct? We said that the gluteus maximus continues downward as the iliotibial tract. Very, very correct. Now, if you say you understand that, let's take more past question. The past question says that T for true, F for incorrect. Now, what does the question state? The gluteus medius is attached to the anterior surface of the gluteal trochanter. Is it true or false? We said that what's the origin? The origin is the posterior ilium, especially the superior and the medial gluteal lines, right? Why? Where is the insertion? The insertion is the anterior surface as well as the lateral surface of the gluteal trochanter. We said the gluteal trochanter is the what? Is the region of the word of femur. So is this statement correct? Very correct, very correct. Making true to become the answer. Do you understand that? Now let's now talk about the deep muscles. We have listed the superficial muscles. We said the superficial muscles are your MMM as well as your tensor fascial lata. What are now the deep muscles? Don't forget we have listed them. We say we have the piriformis muscle, we have the obturator internus muscle, we have the superior and the inferior gemini, and we have the quadratus what? The quadratus what muscle. Now look at it. You can see first from this diagram, you can see that this muscle you can see at both sides is the piriformis muscle. This is the piriformis muscle here, and you also see it here. This piriformis muscle is the landmark for sciatic nerve. So if they ask you what are the relations of the sciatic nerve, you can see that. Number one, this one is the piriformis muscle. This one is what called the obturator internus. The one above is called the superior gemini. The one below is called the inferior gemini. This is the quadratus femoris muscle. Now let's label them. We said this is the piriformis muscle. True or false? That's the word piriformis muscle. And we said this is called the word the obturator internus muscle. You can see that the obturator internus muscle is dividing the gemini into two. We're able to call the superior gemini, and we're able to call the word the inferior gemini. And the last one is what to call the word the quadratus femoris. Do you understand? Everybody, what do we say is the function of the deep muscles? Say the deep muscles are the lateral rotators of the word of the thigh, right? While we say the superficial are for extensors of the hip joint, we say they are for AB dots. Right, AB dots of the hip joint, and we say they are medial rotators, while the deep ones are the lateral rotators. Please, do you understand that? If you say you understand that, let's take one or two past questions. The past question says that the gemini muscles are separated by option A, say piriformis muscle, quadratus femoris muscle, obturator internus muscle, gluteus minimus. Everybody, what's the answer? We said that the gemini muscles are divided into superior and inferior. Who is dividing them? Obturator internus, making option C to become the answer. Do you understand that? Now, if you say you understand that, let's now still talking about the gluteal region. What are the blood supply? What are the nerve supply? And what are the function? First, take note that the nerve supply of the gluteal region is one, the superficial gluteal nerve. We're going to talk about nerve, overview of nerve, but just to know, are you seeing one thing about anatomy is that what you constantly see become part of you. So we're going to learn them over and over and over. What are the nerves of the gluteal region? We say this, we have the superficial gluteal nerve. We also have the word deep gluteal nerve. Of course, the superficial is going to innervate the superficial muscles. What are the superficial muscles? We'll talk about the MMM, right? While the deep gluteal nerve will innervate the deep gluteal muscle, which are your piriformis muscle, your obturator internus, superior gemini, inferior gemini, your quadratus muscle. Now, what is now the blood supply? The blood supply, of course, is going to be your superior gluteal artery and vein, inferior gluteal artery and vein, and we have the internal pudendal artery. All these are arteries from the internal iliac artery. All these are branches from the internal iliac artery. I know you'll be saying what's the internal iliac artery. When I get overview of blood supply, you will know that. I just want you to know, everybody, what are the nerves of the gluteal region? We have the superficial gluteal nerve, the deep gluteal nerve. What are the arterial and venous drainage? We have the superior gluteal artery, inferior gluteal artery, and the internal pudendal artery. Now, what are now the functions? We talk about the function of the superficial. Most of the functions. Number one, we say they are extensors of the hip joint. Number two, we said they are adductors of the thigh, and we said they are medial rotators of the word of the thigh. Why the deep ones? What the function of the deep ones? We said they are what? They are lateral rotators of the word of the thigh. Please, this is everything about the muscles of the gluteal region. Of course, this is overview. Are you seeing that we are doing overview? You are going to treat all of them one after the other. I hope you understand this class. You can pause it and watch it over and over again. Very quickly, when it comes to creating accounts, how do you create an account? Very easy. Let me give you the steps. First and foremost, you say create account and log in. You only log in, right, when you already have an account. Since you don't have an account, click on create account. When you get there, put in your phone number. Put in your phone number. After putting in your phone number, you click on continue, right? Your first name, of course, you put in your first name there. If your first name is James, you put in James as your first name. Your last name, if your last name is Victor, you put in what? Victor as your last name. Then you come to email address, right? Put in your email address there very quickly. James112 at gmail.com. At gmail.com. Then your password, right? Oh yes. Those of you that like, if you want to use your name, your password can just be like 6 digits, right? Oh yes. So let me say James 12 as the password, right? Fill everything accurately and correctly. James 12. Don't jump any stage. If not, your account is not going to open for you. Select education. Under select education, of course, university. You click university. Leave secondary, primary, leave the others. Click university or tertiary. Click it. Come to select level. Under select level, you go and select your level. If it's 100 level, 200 level, of course, all these are the university classes. Click on 200 level and click on create account. Once you click on create account, what will happen? Your class will load straight and then your profile will be set up and then it will take you to what? To class. Easy and direct. So you see it. This is how you create your account. And then from here, you can see that you have your anatomies here, your upper limb, your lower limb, separately embryology, histology, systemic anatomy. Those ones are for nursing. Your CVS, cardiovascular system, your blood physiology, excitable tissues, systemic physiology, intro to biochemistry, your biomolecules, BCM for nursing, nursing psychology. You have access to every single thing in the app. Now, let me see what is in the app. Let's say, for example, upper limb. You click on the upper limb, right? You can see that you have your classes there already waiting for you. Overview of the upper limb, pectoral region, arm region, forearm, hand, all of them part by part. When I click on the overview of the upper limb, of course, I'll just match it straight to my class. Parts of the upper limb, 1 part of the upper limb, 2 bones of the upper limb, joints of the upper limb, muscles. You see, all your classes are there for you, right? Okay, let me say I want to start now, and then I want to watch joints of the upper limb. All you just need to do is click on that particular class that you want to watch, joints of the upper limb, and what will happen? Your class will load, and your classes will start playing for you immediately. Shall you see? You may choose to say, okay, I want to rotate it, right? Oh yes, rotate it, and you start following your classes immediately, easy and direct. You may choose to say, okay, you want to forward, you want to pause, you want to back forward, anyone you want to do. And you take it forward, and what happened? You can see all of them very, very easy. And the sweet part is that there are questions for you at the end of every class. Are you with me? So that's for that. And you may choose to go back and then go to the notes section of the app. Oh yes, when you get to the notes section of the app, of course, the notes are there, well organized and arranged for you. And you can zoom in and then start following back to back, and you are following. You may even choose to go and start answering questions. Questions are there for you, and their answers. You start following through every singular facet of it, and you are learning on your own. And there is CPT in the app as well for you. A lot of other aspects that you can follow up. All of this in the LearnLift app. Same way you have for anatomy, that's how you have for physiology, that's how you have for biochemistry. Are you getting it now? For the now, bye-bye. Now, to wrap up, this is the function. When we say extensor, extensor means to increase the joint, right? So these are extensors. We said which ones are the extensors of the hip joint? Superficial, right? Superficial gluteal muscles. These are what your abductors, AB, to move away from the midline. So that's the abductors of the what? Of the hip joint. Which muscles? Superficial, right? And this is what we call the word medial rotation. Medial rotation is to move the leg towards inward. Why this one is to move the leg what? Outward. Are you seeing that? Towards the midline, medial rotators towards the midline, lateral rotators away from the what? From the midline. And who does lateral rotation work? We said lateral rotation work is done by the word deep. But medial rotation, abductors, extensors of the hip joint are done by the superficial. Do you understand that? Now let's take on the two past questions again. Write T for true, F for incorrect. The question says that gluteal maximus, please follow the question. Gluteal maximus, piriformis muscle, and the quadratus femoris are involved in hip abduction. True or false? Tell me your answer. If you miss it, I will blow it. Now, who are for the hip abduction? We said it is superficial. What is superficial? Gluteal maximus, medius, minimus, tensor fascial lata. Why those that are for your lateral rotation are your what? Deep. So here now we have for hip abduction, it is the word is superficial. We really have one superficial here. Yes, piriformis is deep. Quadratus femoris is deep. So this is correct, but for piriformis is wrong. For quadratus is what is wrong. So making option, making force to become the word, the answer. The answer becomes your word force. Do you understand that? Now, if you say you understand that, in our next class, we'll now go talk about the muscles of the thigh. The muscles of the thigh are divided into three: anterior compartment, medial compartment, and the posterior compartment. We'll do that in the next class. For now, peace out. Hope you've enjoyed this class. Guess what? To follow up for more classes, just download the LearnLift app, whether on Play Store or App Store, and then follow up your classes. You must do extremely well. I'll see you in class. Bye-bye.